Clinically Speaking is our advisor series of short videos featuring clinical updates from Vitality clinicians and experts in their fields.
With the UK facing high infection rates for COVID-19 and Omicron still spreading rapidly, the UK has removed restrictions, and that includes mask wearing in public and return to work guidelines. To find out why now is the right time to be removing restrictions, we caught up with Dr Anushka Patchava and Dr Harpreet Sarna of the Vitality clinical team.
So despite the high infection rate for COVID-19, the government feels it's now is the right time to lift restrictions, predominantly because of the high vaccination levels in the population. So most people in the population have had the opportunity and have taken up the double dose of the COVID-19 vaccination. And as you know, right now we're unveiling the booster vaccination program. And again, the uptake of that has been very, very good.
So are we becoming more immune in the UK? We've had a very successful rollout of our vaccination program with really impressive percentages of people who've had their first dose, second dose and booster dose of vaccines. In addition, we've had over 16 million positive tests for COVID. So I think we have to work pulling that together. In the UK at the moment, we probably have a sort of good level of immunity, but there are lots of unknowns. What we don't know is how long does that immunity last. So we've seen over the last few months the need for a booster program with the vaccines, because it was shown that either that immunity was dropping or we had new variants, like we had Omicron.
So recently, a paper published in Nature mentioned that variants such as Omicron and Delta carry mutations that blunt the potency of the antibodies that we in ourselves, as Harpreet was mentioning, raised against COVID-19 and the molecule. But what we do believe is happening is that it's not that the variants are less harmful per se or less virulent. It's just that our bodies are growing stronger and immunity of our bodies is increasing, either as a result of vaccination or infection, and that is then allowing us to mount a stronger response and for the effects of any of the variants to have a less of a physical effect on us in terms of symptoms, etc.
So I kind of want to be really clear that if we do enter an endemic phase, it doesn't mean that COVID is now harmless. There are different ways of looking at when COVID or any infection goes from being a pandemic to an endemic. And usually endemic means that the disease outbreak, so here COVID, it's consistently present, it's more limited to an area, and we can make predictions on the disease spread. We aren't in an endemic state yet. I remember reading sort of last summer and autumn articles predicting that we were very close to entering an endemic, and then we had the Omicron variant. So, we aren't there yet, but hopefully that's the direction of travel.
It's really hard to say what's next for the pandemic. Globally, I think we've delivered nearly 8 billion doses, and that itself, the vaccination push, shifts the evolutionary landscape of the virus. It's not clear if the virus will rise to this challenge and be able to, morph into more variants, or if we have overcome that and now we can control viral spread through what we're doing in terms of public health measures and vaccination. For me, I believe that we've learned so much from this pandemic. We've learned concepts of social distancing. We've learned to remind ourselves more than ever before about hands, face, space, and the importance of washing your hands and hand hygiene. And equally, we've learned to live with wearing masks in crowded environments. And I don't think 2022 will render itself to us not wearing masks and not thinking about the things that we've learned during this pandemic, because the pandemic in itself is so much at the forefront of all of our minds. I think as we go through, most researchers expect that COVID-19, which is the fifth, I think, coronavirus that has ever entered the human ecosystem, will eventually become less and less virulent, and maybe will be regarded more like respiratory viruses and the common flu. When this shift will occur is what we don't know, and what this infection might resemble in the future is to be seen.